Hello. Have you ever felt a sudden numbness in one of your arms for a few minutes, then it disappeared? Or suddenly stuttered, forgot the word you were going to say? You might think it's just fatigue, lack of sleep, or erratic blood pressure. But according to California neurologist Dr. Mark Ellison, it's those small, fleeting signs that are the first warning signs of an impending stroke, and most elderly patients ignore them. According to a recent survey from the American Stroke Association, up to 67% of people over 60 have experienced at least one early warning sign of a stroke, but less than 30% of them seek medical attention immediately after it happens. The common reason is, I thought I was just tired. This is an extremely dangerous subjectivity because strokes not only come unexpectedly, but also progress very quickly, in just a few hours or minutes. Let's find out together. 10 early stroke warning signs that many people ignore. 1. Numbness or weakness on one side of the body, even if only briefly. Numbness in the arms, legs, or a feeling of losing control of the right or left arm can last only a few minutes. But don't ignore it. According to Dr. Ellison, a stroke usually begins with an interruption of blood flow to a small area of the brain. The initial signs are often mild, but if not treated promptly, it can progress to a full-blown stroke. This condition is often easily confused with poor sleeping posture, potassium deficiency, or sciatica. However, if you have no history of musculoskeletal problems, and the numbness appears suddenly without a clear cause, especially on only one side, it could be a warning. 2. Temporary loss of vision or double vision. One of the most commonly overlooked signs is blurred vision, double vision, or a feeling of cloudiness across the field of vision. This usually lasts only a few minutes and then goes away, leading older people to think it is due to dry eyes, cataracts, or fluctuating blood pressure. According to a study by the Mayo Clinic, more than 25% of stroke patients have experienced sudden vision loss in one eye a few days or hours before. This is a sign of a temporary retinal ischemia, also known as a mini-stroke. If you or a loved one experiences a rapid change in vision, especially in one eye, seek medical attention immediately. Don't wait until the next day. 3. Difficulty speaking, slurred speech, or loss of choice of words. If you are having a conversation and suddenly can't find the word you want to say, or can't speak clearly, this is a clear sign of a temporary speech disorder due to lack of blood to the brain. A 2023 survey from Johns Hopkins University found that 38% of hospitalized stroke patients had experienced temporary slurred speech in the previous 72 hours. However, most thought it was due to old age or fatigue. Don't confuse difficulty speaking with normal aging. Long-lived people are often those who know how to listen to unusual signals from their bodies. 4. Severe headaches with no known cause. Not all strokes cause headaches. But if you've never had severe headaches in the past and suddenly feel a pressure or a popping pain in your head, that's a red flag. According to Linda Matthews, MD, a neurologist in Oregon, this type of headache can be a sign of a brain hemorrhage, a less common but much more dangerous type of stroke. A headache that comes on suddenly, unrelated to stress or changes in the weather, needs to be evaluated immediately. 5. Unexplained loss of balance and dizziness. Dizziness can be caused by lack of sleep, low blood pressure, or the inner ear. But if you are standing and suddenly feel dizzy, disoriented, and unable to walk straight, don't try to rest for a while. It could be an early sign of a stroke in the cerebellum, the part of the brain that controls balance. A 72-year-old patient in Ohio, Mr. James Turner, once shared on a senior health forum, "I thought I was just dizzy due to the change in weather, so I lay down to rest. But my wife insisted on calling an ambulance, and thanks to that, I was diagnosed early. If it had been 30 minutes later, the doctor said I could have been paralyzed on one side." Why do seniors often ignore these signs? There are 3 main reasons. Subjective psychology, thinking that the symptoms are just a part of aging. The symptoms are transient, disappearing after a few minutes, so they think they are cured. Lack of specific knowledge, not knowing that stroke can have early signs. But don't forget, time is brain. Every minute of delay in treating a stroke, more than 1.9 million nerve cells can be destroyed. Early recognition, quick action, is the only way to protect brain health and the ability to live independently after age 60. 6. Sudden irritability, depression, or confusion. The frontal region of the brain controls behavior, emotions, and judgment. When ischemia occurs in this area, the elderly may become strange, unusually quiet, reluctant to talk, losing patience with loved ones, getting angry easily, not caring about personal hygiene or eating as usual. George Miller, 76 years old, Minnesota, shared, "I found myself no longer interested in the garden, although I used to take care of it every day. My wife said I was irritable and forgot words. A few days later, I fell while pouring coffee, and the doctor said I had just had a TIA without knowing it." Don't ignore small changes in emotions and behavior. It's not just a mood. It can be a sign that your brain is having a circulatory disorder. 7. Mild seizures, even if they are brief. Not everyone who has a stroke has a seizure. But according to a 2023 survey by the Mayo Clinic, the rate of stroke patients who have had a mild seizure before is about 12%, and this number is higher in the elderly group. Mild seizures in the elderly often have unclear manifestations. A finger or hand shakes slightly. Facial muscle twitches for a few seconds. Eyes roll or stare into space. Because they happen quickly and without obvious loss of consciousness, family members can easily ignore them. But according to Dr. Rachel Morgan, if you see a mild seizure with no clear cause, no fever, no infection, it could be a neurological sign warning of damage to small blood vessels in the brain. 8. Difficulty swallowing, thought to be a dry throat, is actually a mild stroke. Difficulty swallowing does not only occur when you have a cold or sore throat. Sometimes the elderly feel that food is difficult to pass, choking even though they still eat slowly. This is a sign of mild damage to the area of the brain that controls the movement of the throat and pharyngeal muscles. According to the National Stroke Center, up to 20% of stroke patients have difficulty swallowing for several days to several hours before the actual stroke. In many cases, doctors discover this sign after the patient has aspiration pneumonia, a complication caused by food entering the airway without the patient realizing it. If you find yourself coughing when eating, feeling stuck in your throat, or having pain when swallowing, seek medical attention immediately, especially if it is accompanied by weakness on one side of the face or a change in your voice. 9. Change in gait, slow steps, slight loss of balance. One of the early signs that many people ignore is a change in gait and balance, especially taking smaller steps than usual. Uneven steps, one foot dragging more than the other. Feeling like the person is leaning slightly to one side. Paul Adams, 82 years old, who lives in Florida, said his wife noticed that he was dragging his right foot more when walking. "I didn't pay attention, thinking it was joint fatigue. But the doctor discovered that I had a small lesion in the cerebellum. If I hadn't intervened early, I could have fallen and had a severe stroke." The body always gives early signals. It's just whether we pay enough attention. 10. Sudden memory loss can be a symptom, not a sign of old age. Memory loss is common in the elderly. However, the difference lies in the degree and time of occurrence. If you can't remember what you ate this morning, confuse the name of a loved one while chatting, forget the task in the middle, and especially if this happens suddenly, not gradually, then you should suspect damage to the small blood vessels in the hippocampus, where memories are stored. A 2022 Harvard study found that mild temporal strokes can lead to a phenomenon called transient global amnesia, a temporary loss of memory that is then recovered. But this warns of a greater risk of stroke in the near future. The scary truth: more than 1/3 of people who have had a stroke had early signs within the previous week. According to the World Health Organization, about 36% of recorded strokes have obvious early signs, but the patient or family members do not act promptly. And this is especially common in people over 60. The reason is not because of lack of attention, but because these signs often occur individually, not at the same time, occur briefly, then disappear, easily confused with symptoms of other diseases. But that does not mean they are harmless. According to Dr. Morgan, every small sign is a valuable warning. Acting early can save your life or the life of a loved one. 7 mistakes that make the elderly ignore stroke warnings. Why do many elderly people ignore the warning signs of stroke, even when their bodies are clearly speaking? Why do some people have blurred vision, stagger, or slurred speech, but still do not go to the doctor? Boston neurologist Dr. Peter Lawson has more than 30 years of experience treating strokes in the elderly. He said, "Stroke is not a sudden event. It is often scheduled by a series of early signals, but most elderly people do not know or subjectively ignore it." And below are the 7 most common mistakes that cause those valuable warnings to be ignored, leading to unfortunate consequences. 1. Assuming that symptoms will go away after rest. Many people feel numbness in their hands, headaches, blurred vision, and decide to lie down or take a nap to get better. However, according to a survey from Yale University with more than 2,000 stroke cases, over 40% of patients have fallen asleep while having a stroke, causing serious delays in emergency care. Strokes need to be treated within the golden time, ideally within 3 hours. Ignoring the signs because you hope it will go away on its own is one of the most dangerous mistakes. 2. Confusing stroke signs with other diseases. Many people mistake signs such as loss of balance due to spinal degeneration, double vision due to cataracts, slurred speech due to dehydration. This overlap makes the elderly subjective. But Dr. Lawson emphasizes, if the symptoms come on suddenly, do not last for many days, and have no clear cause, you need to think about the nervous system immediately. Mistakes make the opportunity for effective treatment pass, and when a stroke actually occurs, the brain damage is irreversible. 3. Not believing that you are at risk for a stroke. If I have never had high blood pressure, why would I have a stroke? This is a common misconception. But according to the CDC, nearly 20% of people who have a stroke do not have a clear underlying disease. The risk of stroke comes not only from cardiovascular disease, but also from uncontrolled mild diabetes, chronic insomnia, prolonged stress, lack of exercise. Mrs. Cynthia Hayes, 69 years old in Colorado, is a typical example. She used to think she was healthy because she did not have high blood pressure, was not obese. But one morning, her mouth was crooked and she stuttered, and a stroke occurred. Later, the doctor discovered that she had hypercoagulability due to late menopause, a risk factor that is rarely mentioned. 4. Arbitrarily finding excuses instead of going to the doctor. Many elderly people self-diagnose. It must have been because they ate too much salt yesterday. It must have been because of the change in weather. It must have been because I sat in the air conditioner for too long. Meanwhile, the body is trying to send a warning signal. Dr. Peter Lawson said that this is a manifestation of the psychological denial of the disease, especially common in independent people who do not want to bother their children and grandchildren. However, this delay is the leading cause of stroke, causing paralysis, memory loss, or death. 5. Ignoring the signs just because they last a few minutes. There is a very dangerous thing: a transient ischemic attack, also known as a mini-stroke. It only lasts a few minutes to less than 1 hour, but warns of the risk of stroke within the next few days. If you have any temporary symptoms such as loss of speech, weakness in the limbs, loss of vision in one eye, and they recover on their own, it is not a sign to be reassured, but an extremely serious warning. TIA is a golden opportunity to prevent a stroke, if you know how to recognize it. 6. Not sharing symptoms with relatives. A reason that few people talk about. The elderly often hide strange symptoms for fear of worrying their relatives. But this silence can take away the chance of survival. Mrs. Linda Parker, 74 years old in California, sighed, "I had a little numbness in my face in the morning, but did not tell anyone. In the evening, I had a severe stroke. My son said, 'If you had told me sooner, we would have taken you to the emergency room.' When you see something unusual, say it. You do not bother your relatives. You are saving yourself." 7. Lack of basic knowledge about stroke signs. A survey from AAPI shows that only 48% of people over 60 in the U.S. know the 3 main signs of a stroke. That's why the FOST campaign is encouraged. F. Face. Is your face distorted? A. Arms. Can you raise your arms evenly? S. Speech. Is your speech distorted or difficult to understand? T. Time. If any of the above occurs, call 911 immediately. Ignorance slows down your response. Every minute that passes, nearly 2 million brain cells can die, and you can't get them back. So, how can seniors act correctly when there are signs of a stroke? Always remember the 3 principles. Sudden, one side of the body, short but clear. Never ignore. Make a warning list. Record minor symptoms. If you see them repeatedly, see a doctor immediately. Take action now. Don't wait until tomorrow morning. Every second counts. Update your knowledge. Share this video with your loved ones. Awareness is the first step to saving lives. Doctor reveals factors that cause stroke and natural prevention for people over 60. Did you know that there are seemingly insignificant factors that silently cause millions of seniors to have strokes each year? And conversely, there are very small changes in lifestyle that can significantly reduce the risk? Dr. Andrew Kaplan, a neurologist at Mount Sinai Hospital, New York, affirmed, "Stroke is not a fate of old age. We have seen many people live past the age of 90 without ever having any cerebrovascular problems, simply because they know how to avoid 5 main risk groups and maintain a few simple habits every day." In this section, we will learn about top 5 risk factors for stroke in the elderly, natural prevention methods without medication, experience of living long and clear-mindedly from real long-lived people. 1. High blood pressure, the silent killer. This is the #1 risk factor for stroke, especially in people aged 60 and over. According to the CDC, more than 70% of strokes occur on the basis of poorly controlled high blood pressure. It is worth noting that high blood pressure is painless and often has no obvious symptoms. Patients only know when it is too late. If your blood pressure regularly exceeds 140/90 mmHg, be careful. Natural prevention. Reduce salt. Eat less than 1,500 milligrams of sodium day. Increase light exercise every day. Walk 20 to 30 minutes. Reduce caffeine and limit alcohol. Henry Wallace, 91 years old, living in Kansas, shared, "I check my blood pressure every morning after brushing my teeth. Write it down in a notebook. Thanks to that, I have controlled it for 30 years without having to take many medications." 2. Diabetes. Don't take it lightly, even if it is only mild diabetes. Diabetes damages the endothelium, which is the layer that protects normal blood flow in the brain. This damage makes it easier for blood clots to form, leading to stroke. Many older people are diagnosed with prediabetes and think they don't need treatment. But according to a survey from Stanford University, more than 35% of strokes occur in people with high blood sugar, but not yet diagnosed with diabetes. Natural prevention. Eat foods with a low glycemic index. Limit simple sugars. Avoid cakes, soda, and packaged fruit juices. Check your fasting blood sugar every 3 to 6 months if you are over 60 years old. 3. Dyslipidemia, the hidden culprit causing cerebral vascular occlusion. Bad cholesterol and high triglycerides are the cause of plaque buildup, narrowing the cerebral arteries. According to the American Heart Association, each year there are more than 200,000 strokes related to dyslipidemia. The danger is that the symptoms of high blood lipids are very faint. Patients do not feel pain, do not feel tired, and can still function normally until the blood vessels are blocked. Natural prevention. Eat lots of green vegetables. Prioritize good fats: olive oil, avocado, salmon. Avoid fried foods, animal organs, animal butter. Doctors recommend check blood lipids at least once a year after age 60, even if there are no symptoms. 4. Sedentary lifestyle, the modern culprit. Sitting a lot, moving little, and being lazy to exercise are common conditions in the elderly. But this is the factor that causes the circulatory system to stagnate, increasing the risk of blood clots. A 2022 study by the University of California showed that elderly people who sit for more than 8 hours a day have a 62% higher risk of stroke than those who walk regularly. Natural prevention. Walk for 15 minutes after meals. Do light stretching exercises every morning. Stand up and walk for a few minutes every 45 minutes of sitting. 5. Stress and sleep disorders. Factors that are often overlooked. Prolonged stress increases the hormone cortisol, causing vasoconstriction. Increasing blood pressure can increasing platelet adhesion, all of which increase the risk of stroke. Lack of sleep or poor sleep prevents the brain from resting properly, making it easy to disrupt neurotransmission. According to a survey by the American Academy of Sleep Medicine, elderly people who sleep less than 5 hours per night have a double risk of stroke compared to those who sleep 7 to 8 hours. Natural prevention. Meditate or breathe deeply for 5 to 10 minutes every morning. Turn off electronic devices 1 hour before going to bed. Drink chamomile tea, passion flower tea, instead of sleeping pills. Principles to prevent stroke in the elderly. Keep blood pressure stable. Maintain a diet rich in green vegetables, low in salt. Maintain a regular exercise routine every day. Avoid tobacco, strong alcohol. Avoid stress and staying up late for long periods. Regular checkups, blood pressure, blood sugar, blood lipids, cardiovascular function. Mrs. Dorothy Simmons, 88 years old in Seattle, said, "I do not follow a strict diet, but I listen to my body. If I feel dizzy, I sit down. If I have difficulty speaking, I call my child." By regularly checking, exercising, and thinking positively, I have never been hospitalized for a stroke. Her story is no exception. Thousands of people over 80 years old are still living healthy, walking, playing golf, because they are proactive in stroke prevention. How to react when a stroke occurs. The first 10 minutes determine life. If you are talking to your husband and suddenly see him not responding, his eyes are staring, his face is twisted to one side, what will you do? Within just a few minutes, the brain begins to die if blood is not circulated again. And you will be the one to decide whether he survives or not, and whether he can walk or not afterwards. There is no more critical time frame than the first 10 minutes after a stroke occurs. A quick and timely response is vital, says Dr. Charles Benson, a stroke specialist at the Mayo Clinic. Prevention and Action Toolkit for Seniors. 1. Recognize stroke immediately with the FIST formula. Dr. Benson emphasizes that even if you are not a medical professional, you can still save someone's life by remembering these 4 letters. F, face. Ask the person to smile. Is one side of the face drooping? A, arms. Ask them to raise both arms. Is one arm falling or unable to lift? S, speech. Ask them to say a simple sentence, for example, "What a beautiful day." Is their speech clear? Tea time. If any of the above signs are present, call 911 immediately. Do not wait. Do not try folk remedies. Do not ask for advice from others. Calling an ambulance is the first and most important step. 2. What to do in the first 10 minutes. If you suspect a loved one is having a stroke, follow these steps. Call 911 immediately. Don't wait. Every minute that passes, 2 million brain cells die. Provide an exact address, describe the symptoms, and the time they started. Remember when the symptoms started. This time is important for the doctor to decide whether to inject a thrombolytic drug. Let the patient lie still with the head slightly elevated. Do not move the patient unless necessary. Place a pillow under the head to help blood circulation. Loosen clothing. Open a window for ventilation. Avoid suffocating the patient due to tight clothing. Observe changes. Are there seizures? Are there vomiting? Take note and notify medical staff when they arrive. Things you should absolutely not do when providing first aid for a stroke. Do not give water, medicine, or anything to eat. People who have had a stroke often lose their swallowing reflex. Giving them water can cause them to choke, which can lead to dangerous aspiration pneumonia. Do not use aspirin unless prescribed by a doctor. If the stroke is caused by a brain hemorrhage, aspirin will make the condition worse. Do not drive the patient to the hospital unless absolutely necessary. Ambulances are not only faster, but also have specialized emergency equipment. If the patient loses consciousness in your car, you will not be able to handle it in time. Do not slap, shake, or perform artificial respiration if the patient is still breathing. This will not help and can cause further damage. If you find this video helpful, please send it to relatives and friends over 60. Print and post the FAST board at home. Practice responding to stroke situations. Share your story below to raise awareness together. Because stroke is not just a medical issue, it's about every family, every moment, and every timely decision.